Fosinopril is an ACE inhibitor used to treat mild to moderate hypertension, congestive heart failure, and to slow the progression of renal disease in hypertensive diabetics. In this video, let's find. What is Fosinopril? What is Fosinopril used for? Contraindication. What are the side effects of taking Fosinopril? How does Fosinopril work? How to use Fosinopril? What is Fosinopril? Fosinopril is an angiotensin-converting enzyme, ACE, inhibitor used for the treatment of hypertension and some types of chronic heart failure. Fosinopril is the only phosphonate-containing ACE inhibitor marketed by Bristol Myers Squibb under the trade name Monopril. Fosinopril is a cascading prodrug. It was patented in 1980 and approved for medical use in 1991. What is Fosinopril used for? For treating mild to moderate hypertension, use as an adjunct in treating congestive heart failure, and may be used to slow the rate of progression of renal disease in hypertensive individuals with diabetes mellitus and microalbuminuria or overt nephropathy. Contraindication. Fosinopril is contraindicated during pregnancy due to its ability to cross the placenta. As a result, it may increase the risk of fetal malformations and cause congenital disabilities or death to the developing fetus. Side effects. Fosinopril use can result in dizziness, cough, upset stomach, vomiting, diarrhea, headache, excessive tiredness, weakness. Pharmacodynamic. Following oral administration, Fosinopril is rapidly and completely hydrolyzed to its principal active metabolite, fosinoprilat. Hydrolysis is thought to occur in the gastrointestinal mucosa and liver. Fosinoprilat is a competitive inhibitor of ACE, a peptidyl dipeptidase that is part of the RAAS. The RAAS is a homeostatic mechanism for regulating hemodynamics, water and electrolyte balance. During sympathetic stimulation or when renal blood pressure or blood flow is reduced, renin is released from the granular cells of the juxtaglomerular apparatus in the kidneys. In the bloodstream, renin cleaves circulating angiotensinogen to ATI, which is subsequently cleaved to ATII by ACE. ATII increases blood pressure using a number of mechanisms. Mechanism of action. There are two isoforms of ACE, the somatic isoform, which exists as a glycoprotein comprised of a single polypeptide chain of 1277, and the testicular isoform, which has a lower molecular mass and is thought to play a role in sperm maturation and binding of sperm to the oviduct epithelium. Somatic ACE has two functionally active domains, N and C, which arise from tandem gene duplication. Although the two domains have high sequence similarity, they play distinct physiological roles. The C domain is predominantly involved in blood pressure regulation, while the N domain plays a role in hematopoietic stem cell differentiation and proliferation. ACE inhibitors bind to and inhibit the activity of both domains, but have much greater affinity for and inhibitory activity against the C domain. Fosinoprilat, the active metabolite of fosinopril, competes with ATI for binding to ACE and inhibits and enzymatic proteolysis of ATI to ATII. Decreasing ATII levels in the body decreases blood pressure by inhibiting the pressor effects of ATII as described in the pharmacology section above. Fosinoprilat also causes an increase in plasma renin activity likely due to a loss of feedback inhibition mediated by ATII on the release of renin and/or stimulation of reflex mechanisms via baroreceptors. Half-life. Fosinopril has an effective half-life of accumulation of 12 hours. Dose. The dose of this medicine will be different for different patients. Hypertension. 10 mg per initially, no more than 40 mg per day. Congestive heart failure. Adjunctive to diuretics and/or digitalis. 5 to 10 mg per initially, no more than 40 mg per day. Safety advice. The FDA places Fosinopril in Category C for the first trimester and Category D for the second and third trimesters. It has been shown that use of Fosinopril in pregnant women caused some babies to be born with problems. That's all the information about Fosinopril we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.